Hey everyone, good morning or afternoon from wherever you may be joining us. This is Matt with Provider Trust, and first I want to say thanks to everyone for choosing to spend their hour with us this month. If this is your first webinar, welcome. We are really lucky and happy to share these kinds of presentations with the healthcare industry, and today is another great Provider Trust webinar that we hope provides a lot of value for you. So thanks again for being here, and a little bit about today's presenters. One, you may recognize if you've been with us before is Mike Rosen, our co-founder, who has 30 plus years experience in the background screening and compliance industries. And we are very lucky to have him as a thought leader at Provider Trust. With him will be Tim Ridgway, who is our HR solution consultant. He works with HR folks across the nation to identify their issues and kind of find some places where they can streamline some workflows, and really just he helps HR professionals, and that's what he does here at Provider Trust. So today's presentation is how top HR teams manage license and credential verification. And again, we're very happy to share this information with you. Hope you find it valuable. And a few things before we really get into it here. I want to let you guys know that this afternoon you will receive a copy of the slides as well as a recording. This webinar is pending approval from the CCB currently, and we are sure that it will be approved for those CEUs that we mentioned. And you will receive that as soon as I receive our CEU certificate, and I will be happy to share that with you guys ASAP, I promise. So let's get into it a little bit. Provider Trust, we are here in Nashville, Tennessee, and we help compliance and HR professionals with software solutions to make their lives easier, to make their jobs work more efficiently, and to make them happier ultimately is our goal. So that's a little bit about us. We try to focus on making healthcare smarter so that it can be safer. We really try, our promise and how we fulfill that is we monitor your healthcare populations to identify compliance and credential issues before they impact your patients. So that's just a little bit about us at Provider Trust, and our webinars are monthly. One of our values here at PT, as we call it, is to help others grow and succeed. So we're happy to share plenty of resources. We actually just redid our website, and we have a resource library with 300 plus resources for you guys to use, a very thorough blog, as well as many webinar recordings and ebooks for you to kind of digest and learn. So we're happy that you're here with us to join, learn, and grow. Next month's webinar, which will close up our HR webinar series, is how top HR teams focus on culture by developing and empowering people. That is on September 25th at noon Central. All of our webinars are always at noon Central time. So sorry for you Eastern time folks. There's other time zones too. But Central time is what we go by, and noon, and we hope to see you there. So today's agenda, we will kick it off with the role of HR and license verification, and then, sorry for the numbers there, that just happened in a formatting issue, but then we'll follow up with navigating your verification process, followed by holistic provider monitoring, and then finally we will bring it to a close with licensure as a key component to safer healthcare. So thanks for listening to me for these 4 minutes. And with that, I will hand it over to Mike Rosen. But first, here is our first poll question. And we have 4 of these today, really just to get a feel for who's on the line and who we're speaking to, and really just kind of get an idea for your role at your organization. So we'll just leave these polls open for about 30 seconds tops each, just to give everybody a chance to chime in and submit. So sorry for any awkward silence while we wait for some people to come in, but we'll close this one out. And and show you guys the results. So it looks like what we thought would happen, 46% HR folks on the line. If you do, we're happy to have, obviously happy to have everyone, our compliance folks we've been talking to for a long time. So great to see you guys here with 24%. If you do choose other on any of these polls, we're interested in what that might be. So if you could please just chime in the questions tab and just tell us what that answer is for you. And we will, just so we can get a better feel of who's joining us on these monthly webinars. And with that, thanks for participating. With that, I will hand it over to Mike Rosen to kick us off.
Thanks, Matt. Hello, everyone. It's Mike Rosen, and I'm really glad to be able to talk about some licensure issues, best practice, and how to help you identify whether what you're doing or might need to improve to be better in this area. So we're going to use licensure as an overall topic, but it bleeds a little bit over into the credentialing space. We are not a credentialing CDO company from the standpoint of doing privileging and credentialing for doctors. Instead, we're monitoring ongoing. But I want to tie in the importance of licensure, whether you're in the credentialing process or on the HR side of things. I think we all know that according to the Bureau of Labor Statistics, healthcare is the fastest growing industry now as far as employment and the population of people working in it. It's sort of a moving number to try to find that actual number. I did find to the right, the Kaiser Family Foundation, who spent a lot of time researching this recently in 2018, and they can find or identify approximately 17 million people that work in the healthcare sector. Now that is by nature not inclusive of independent contractors or third parties and even some of the non-licensed professions. But we think it's closer to 20 million when you include all of that. But let's, for purposes of today, talk about the roughly 17 million healthcare providers, a good number of whom are required to be licensed. Now licenses are a privilege. They're not a right. You have to earn a license, just like you do your driver's license or any other license that you may hold. And that means that you have to have a certain skill set, a certain proven and documented ability to do your job in order to hold that license. And there are certain requirements that are continuous that if you were not to meet them could cause that license to be disciplined, revoked, suspended, limited, or pulled altogether. And clearly there's also, the fact that it could be non-renewed by the provider. So there's lots of reasons that a licensure and licenses are important. I'm also going to mention licenses, but tell you a little bit about them. But I think it's important to realize that a lot of the healthcare professions, other than doctors and nurses and therapists, actually hold a certificate or certification. And those are equally important to know where to verify and monitor them, but a little different than a license because a certification typically is issued for a period of time and doesn't get disciplined or could be revoked. They are for simply a period of time, whereas a license is a more fluid and could change document. So we're talking about the roughly 17 million providers in healthcare. No surprise, but the RNs, if you will, the registered nurses, are about 3 million or more. This is a statistic from 2016, which is for the government the most current, and well close to 3 million registered nurses in the United States. Doctors and surgeons, the number is actually closer to 1 million. The asterisk there reflects that it did not include ODs or DOs and others, but we know that doctors are approximately 1 million. So there's 4 million of the 16 million providers in healthcare that just make up those two disciplines. Now, whether you come from the post-acute or acute side or some other part of healthcare, you may also have nurse aides or therapists or radiologists and all other kinds of licensed and certified providers. On the left-hand side, I want to point out to you that we understand that that is a lot to manage and keep up with, and that you have a really difficult task. Whatever department you're in, compliance, HR, IT, or other, somebody has to be aware at all times of the status of these. And if you take the disciplines of roughly 80 types of providers out there, times 50 states, times the numbers of disciplinary boards, you're looking at between 2,500 and 4,000 primary sources that need to be searched to stay current. So we understand your pain, and we want to dive a little bit deeper today on best practice. Thought it was important to tie in because we, of course, are also an exclusion monitoring company, how these licenses and disciplinary statistics affect an exclusion. And so we pulled the top disciplines based on number of volume of excluded providers, and those for which they were excluded based on a license revocation. And you can clearly see that nurse or nurse aides dominates the number of excluded providers, and it goes downward from there in different types of practices. But please know that there are well over 30,000 or close to 30,000 exclusions at the OIG that are for a license revocation. And if you get one thing out of today's webinar, we want you to know that licenses are really a precursor to other and more serious risks or problems to your organization. And that ties in with our smarter healthcare is safer healthcare and how we can help you avoid those things. So the role of HR, and we're going to focus today on HR, whether that's really a part of compliance in your organization. We're talking about HR in particular. The first and foremost, you need to have a policy and procedure for your governance. You need to have a set of guidelines that's going to drive why you're doing this and how to do this. This is because you also need to identify that you're going to be searching primary sources, meaning directly from the primary source for that licensing board or certifying body. If you're not pulling from that, you're not meeting multiple standards, NCQA, Joint Commission, and others, and you're likely violating your own policy. You've got to verify these credentials at that source, and you need to do so on a frequency of really monthly in order to avoid these fines and penalties. Now, a lot of that comes with some documentation and the ability to share and be transparent. One of the things you may not be aware of, but you need to, is you really need to take a screenshot at the primary source when you update that license upon its renewal or verify it at some point in time. And that is because that meets all of the NCQA and Joint Commission requirements to do so. So if you're not currently taking a screenshot of that, at least upon issuance and renewal, you need to implement that as a practice. You can delegate these responsibilities. Credentialing departments do it all the time. Companies like ours take on that responsibility for monitoring licenses, and that is a way to make your life a lot easier. In the other side of the slide here, we want to make sure that you know you can always be survey or audit ready. I mean, at the end of the day, that's where the most pain comes in an organization, and the calls that we get on behalf of our clients are, oh my God, I've got an auditor. They need to know that we have a single source of truth, and we say, relax, here's the software that does that, and here are all of the providers and their history. These are things that you need to make sure in some fashion you have at your organization in order to remain and stay compliant. So I would pose these questions for you to see how you're doing in this regard in your organization. Does your organization have a centralized system that could track and keep track of those licenses so that you are audit ready? Or are they, where we see most of the time, they're multiple places. They're stored in multiple formats, paper or otherwise, sometimes on the floor or at the nurse's station, and it's very hard to gather that and have comfort that it exists without knowing it in some type of centralized system. So best practice obviously is to create or use somebody's centralized system to track it. And that way, when an auditor is there, you can quickly show your compliance and have them move on. How is the status displayed to you? Like if you track this, as most people do in Excel, which is not intuitive and doesn't proactively tell you that something's missing or coming due, how are you going to just be notified when that change occurs and that license suddenly is revoked or suspended? And how does that affect your scheduling? You need to know that in advance or as soon as possible to pull them off the floor if that's a recourse that needs to be taken. What happens when the person changes their name? We see that quite a bit with females, right? They get married, divorced, change their name, hyphenate their name. Are they changing their license to reflect that? These are all things that would be prompts for you to go out and re-verify something, and you need a system to tell you that. And then what other departments might need to know the status? We're going to talk a little bit later about when compliance gets involved. Like what happens when there's an investigation and you may need to get other departments? How are you going to share that information, and where are they going to go where there's a central way to know it? So as we begin to wrap up this section, 3 important things to know. Half, almost right at half of the OIG and state exclusions are based on license revocation. This is a real problem that extends and is a precursor to other and more serious problems. Secondly, you got to know where to verify. You need to go to the primary source. That is directly at the state board, licensing board, to find out what's happening and how current it is, and take that screenshot. And then the frequency. You're going to have gaps if you don't do this on a monthly basis, because licenses can be disciplined or changed that frequently. So what is the risk exposure that produces to your organization? Well, these are some, but not all, and they vary from not knowing a disciplinary action or the status has changed to submitting a false claim when that person in fact isn't licensed. That is a false claim. That can provide both civil and criminal penalties depending on which avenue the Department of Justice or others goes after it. Likely the restricted or revoked license is going to result in an exclusion, and you will know that as a precursor by doing license monitoring. And you're going to get sued for malpractice if, in fact, that doctor wasn't licensed when they were performing that surgery, or that nurse didn't have the status. You've got all kinds of other issues: practicing without a license, negligent credentialing, or retaining somebody who isn't licensed, etc. And all of this can be avoided by doing monthly license monitoring. Now, just to quickly show you, this is the state of Tennessee. This is one of the licensing boards here that regulates healthcare professions. This would be the primary source place to start. You can pick your state to check your professions, but this is where you need to go to get board actions and license verifications. Matt, if you'll show them this next slide, the impact that a provider that has been excluded has with regard to Medicare beneficiaries and Medicare dollars, I thought was interesting. This recently just came out, and it talks about, if you look at those providers that are excluded, they were predominantly excluded for fraud. Some type of fraud was the reason that they are excluded. You got patient harm, in there too. They harmed a patient, but all, if not all of them, were based on a license revocation. And that is the precursor to preventing the fraud or the harm to the patient. So these are real statistics. As we do cover physicians, and not exclusively in today's webinar, thought you might want to know that this is from JAMA, just came out. I've never seen JAMA, the Journal of American Medicine, talk about it, but they did. And the number of physicians excluded per 1,000 in a state, you have West Virginia with the highest number and Montana with the lowest. So you can look and see how your state ranks on a percentage basis of excluded physicians. And then finally, as we talked about, we don't want to leave out, credentialing is important and is a separate part of licensure. For those credentialed positions, they're very inefficient and takes a lot of paperwork and time to do them. It's a slower process that is quite tedious and ripe for delays, and that's very costly to your organization. A study from Becker's Hospital Review showed that just 1 month, or each month's delay that it takes for credentialing to complete all the paperwork that they need, which is done every 2 years, on the average primary care physician, is over $30,000 in lost revenue to your organization. So you're getting the pressure from your leadership and management or board to get these doctors on board as fast as possible because it's costing the organization money, and yet it has to be done correctly. For a hospital that hires 50 primary care physicians, if that statistic's true, that could cost, that's the lack of about $1.5 million in revenue. So that is the landscape of licensure that we want to now talk about best practices. Let's go on to a poll question so we can move on to our next section. And by the way, any questions that you have, please submit them in the questions tab and we'll try to get to them during the session or certainly at the end. The question here is, how often do you at your organization verify or re-verify a license? And there are 5 options here. If you don't know, other is fine. If you don't mind typing in what other is to you, that'd be helpful. But is this done at hire and renewal? Is it done at hire and only on a change in the role of that or position of that person? Is it done annually or at hire only? We'd like to kind of poll the audience. So Matt, let's find out what we find here. All right, not surprisingly, I think most organizations, in this case 2/3, are doing it at hire and renewal. And that's okay, but we're gonna show you where that forms a lot of gaps. 15% are doing it annually, and that is, or at hire, 20% are doing it annually or at hire only. And we're gonna show you where that is a pretty risky position to take and what you can do to solve that. So Tim, I'm gonna turn over to you now on navigating your verification process.
Great, thanks Mike. And again, for the audience, this is Tim Ridgway. And I'll take us through how to navigate your license verification process. So we'll spend a little time on some of the most common challenges in managing the requirements and help you create a smart license monitoring solution within your organization. So some of the most common responses we get when we ask the question, tell me about your license verification and monitoring process, we hear the following, right? Our process is decentralized, I lack competence, or we don't have a centralized system for this type of information, or we had a provider that was working with an expired license and it cost our company some dollars, or we simply don't have a process in place, or there's a lot of people involved, or it's very manual and difficult. And quite frankly, we have the conversation with some providers that have been hit with a penalty. And so some of these comments may resonate with you. Some may only live in your nightmares and keep you up at night. Some of you might feel confident in your process. Overall, there's a wide variety of emotions when we start talking about license monitoring. So let's start talking about some of the challenges that we face when administering the process. And this isn't an exhaustive list, but it should cover some of the biggest challenges that we see and that we hear. And we'll start at the top. So each state, as Mike had discussed already, has a state board of medical examiners who are responsible for administering the licenses to the qualified candidates that apply. They obviously exist to safeguard the health and the safety of patients. And the many state health professional medical boards provide administrative support to these boards to ensure that they have active licenses for their respective professionals. There are over 80 disciplines in healthcare that require a license or certification, and thousands of possible primary sources across these boards that make this very difficult to navigate. So a good first step in the process would be to find out how your state lists the different licenses. Because variability at the primary source on data and the format required to perform a verification differ. So find out where they list the different licenses and which websites hold the actual database. There are also some databases that contain numerous lists for each license, and some lists include all of the licenses just in one of those databases. So you may have a scenario where licenses are lumped together. So again, the first step in verifying licenses is to confirm exactly how your state lists the licenses and where you need to go to locate them. The next step is to know exactly what data and in what format needs to be entered into at that state license board site that has that database. And unfortunately, and believe it or not, if you haven't experienced this, punctuation, dashes, and initials really matter they can make the difference of finding a match on the database or a missed match and not finding a database or a license that actually exists on that database. And so that adds a level of complexity and manual intervention when you enter all of the information that you have on a license and then to go back and kind of back up by each letter and each number until you get the right fit. So understanding that is pretty critical. Another big challenge is latency in reporting disciplinary actions between the individual license and state boards. So in general, the majority of disciplinary boards release their minutes to the license boards each month. However, there are certain cases where it can take weeks, even months, just to type up and publish the actual results or the documents. So the delays then create a scenario where you may have an organization that's 4 to 5 months behind finding a sanctioned employee. And by then you may have a facility that could be racking up fines for employing that sanctioned individual if they're billing Medicare or Medicaid. Another big challenge is provider delays in renewal, right? Since providers' license may not be submitted timely or may be incomplete when they're actually going to file that renewal, they may be in a situation where they're not eligible to practice and may need to be removed from the schedule, which creates some challenges for your patients and your wait times and having to fill that seat within the organization. So we've seen some best practices from our clients where they've implemented processes around ensuring that they don't schedule a licensed provider if they haven't proven renewal at least 5 to 10 days prior to that renewal date. And then nursing and medical licensure compact, right? We see advancements in telehealth that are revolutionizing care delivery. And in today's commuter society, we have many healthcare professionals that may reside in one state and travel or practice in multiple neighboring states. And so licensed nurses and physicians can qualify to provide care and practice medicine across these state lines within the compact if they meet the agreed upon eligibility requirements, which is a great benefit, but it just adds complexity to the process. So with the thousands of possible sources, the complexity in the scenarios, the very labor-intensive intervention that needs to occur, you should spend some time understanding the scope of work required for accurate and for timely verifications to ensure you got the right resources, you've got the right processes, and you've got the right team involved. So another question that we get often, and we've talked about this already, and the poll question just was just asking this question to the group here, is how often do I or should I verify a license? The traditional approach has been a verification would occur upon hire and at time of renewal. However, as we've discussed already and will continue to discuss, is that this approach can leave some critical gaps in assuring that you have properly credentialed providers. So it is a best practice that HR and compliance professionals should have confidence that the frequency of license verifications is sufficient to ensure that no individual within the organization is providing services without a renewal lapse or an administrative action against their license at the point or the time of care. We've talked about accreditors already. For example, the Joint Commission requires that at a minimum, a healthcare employer verifies a license at hire and at renewal. However, we continue to talk about a best practice that calls for a higher frequency. A lot of these regulatory agencies also require that a provider be properly licensed at all times because important changes can happen at any time. To ensure that you've got a best practice in place, you want to make sure you've got caregivers that are eligible to work and that those scenarios don't go unnoticed. Therefore, the best practice, again, is to verify as often as possible. So to help provide a little context to what happens between license verifications, we can look to the 2018 Physicians Foundation survey. And essentially what we're trying to understand is if I'm only looking at a license at hire and at renewal, given the example that we've got a physician who has a license that's renewing every 2 years, there are patient interaction and revenue cycle implications between those renewal cycles. For the survey, it indicated that the average physician sees 18 to 21 patients per day, and generate about $1.5 million in net revenue to their affiliated hospital. So when you distill that down to, okay, what is truly at risk? What is happening between the time I'm verifying the physician's license? There are over 10,000 patient interactions and $3 million in net revenue per physician at risk. And so when you look at it through that lens, it's clear that there's quite a bit on the line within this process to manage and administer. So let's talk about how you can create a smarter license verification process. We've got a list here of 6. This likely isn't exhaustive, but it's a great place to start. Number 1, and Mike talked about this already, establish clear priorities and procedures. I would place emphasis on the procedures that reduce internal fragmentation and variability, particularly if you've got a wide network and you've got a lot of folks within the organization that are supporting HR and compliance functions. For example, centralizing operational oversight within maybe a center of excellence or an HR shared services model can produce and create efficiencies across the organization. It can support cross-functional accountability. From there, you may want to move to standardize the process for the teams that are involved, just to reduce the variability for all of the pieces and components of the process that you're trying to manage. And you might even want to consider developing benchmarks, developing key performance indicators on performance. And we know that behaviors are met when we incentivize them. So maybe create some incentives to drive the behaviors that we're looking for. Number 3, enabling your team with the tools to support the policies and procedures. Obviously, we want to maintain a single source of truth here. I think enabling your team with the right resources will pay dividends. Some key things to consider when designing a strategy should include understanding the technology, how your teams are dependent on it, what are their requirements of the teams that are going to be involved. Pay attention to the specific business rules that support the unique structure of your organization. Things like mapping specific license requirements to specific job disciplines is going to help mobilize the strategy and ensure that there's a standardized process. Leverage dashboarding as much as you can to deliver insights to your frontline or your unit managers, rather than making them comb through emails and reports to find the information that they need. Help them prioritize their day by creating real-time alerts and real-time communication paths. We know that we're dealing with a lot of technology. We've got a lot of technology that we need to support our human capital. So you can reduce fatigue by sourcing the right tools and technology that are intuitive, that are interoperable with your current technology that you're using today. You can look to technology to automate the traditional stuff that's done manually so that your teams can spend time focusing on their highest priorities, likely supporting and enabling their human capital. And then leverage things like digital document storage to reduce your footprint of your file cabinets, and ensuring that reporting is available at your fingertips and is robust enough to create a defensible process in the face of an audit if you're in that situation. And lastly, consider a more frequent license monitoring cadence. Again, we talked about this already, but I want to stress it. Changes happen in licensure, and they can happen pretty quickly. And fortunately today, there's automation that is helping and enabling health care organizations to verify and manage licenses, which leaves a lot less room for error.
And Tim, I'm going to add to that what you're talking about on the daily. I know that's probably in some of your minds maybe overkill, or you're thinking, okay, that's best practice. And certainly we're not saying it's required, but let me tell you where it's really important. For those of you who are employing therapists in particular, whether it's occupational, physical, any other speech, you're billing based on a very defined and billable form that you got to turn in. How many patients did Tim Ridgway see today as a therapist? And so the fines are very easily calculable if today Tim didn't have his license, and that could change on a daily basis. Certainly it could change on a monthly basis. But for those of you who are billing for people specifically based on their services, this is a really important and best practice. It doesn't necessarily apply to all of the professions, and monthly would be certainly the best practice. But just for those of you who are worried about a false claim or a overpayment or something in which because it's very identifiable on a sheet, as opposed to just wages and salaries. The daily is where the market is going.
Absolutely, Mike. Thank you for adding that. Okay, so let's do a polling question. We'd love to understand what your biggest challenge is. We've talked about some of the challenges that we see. So you've got a number of options here. Maybe yours is navigating the primary source verifications, the thousands of potential areas that you'll need to search and source. The frequency of verifying each license, are you struggling with that? Do you want to do it better, but know that you don't have the manpower? Do you have bad license data that's just really keeping you from being able to be effective here? Or communicating across your organization in the event you have to delegate a responsibility, and obviously there may be many others here that you all might be seeing. So we'll give it a few moments for the poll to progress. Perfect. So the vast majority, well, not the vast majority, about 38% of you are challenged with the frequency of verifying each license, which is completely understandable. This is a challenging process to support. The next is communicating to your various teams. There are a lot of people that care about the status of a license. Obviously, HR and compliance, many in scheduling rely on it. Those types of impacts to the organization can affect patient wait times and can affect quality. Navigating primary source verifications and bad license data. Interesting to see that bad license data doesn't have a bigger response to it, which is great to hear. And then we've got a pretty big component of you that are sitting with other. Again, we would love to hear what the other is in the questions pane of the webinar.
Yeah, Tim, I'm really fascinated by the almost 30% of you talking about communication. We've done a webinar, actually the webinar preceding this, for those of you who are interested, and we have it available to you on our resource page, had to do with how HR and why HR and compliance should talk to each other, because we find that in a lot of cases they don't. In a lot of larger organizations, they're not. And I think that's highlighting the frustration or concern that you have, because the data is very important to various parts of your organization, and we're going to cover that in the next couple of sections.
Absolutely. So the next section we'll focus on is holistic provider monitoring, and we'll tell you what we mean when we say that. So our point of view, and Matt, if you want to go ahead and expand the slide, our point of view is that the sanction, the license, the exclusion phases are interdependent of each other. So we've built a solution and a point of view that helps support the three, but it's really important to talk to the way that they communicate with each other and the impact to an organization if you're only looking at, say, a license or say an exclusion, as we've discussed already. As we know, sanctions can turn into licensure issues. Licensure issues can turn into exclusions. We've commented already that nearly half of the current exclusions on the OIG are from a licensure issue. So it's really important to consider when you're developing your compliance program, how should we handle these three separate phases of the life cycle of an action taken that may impact our patients, they may impact our revenue, and obviously just impact the organization in general. To help articulate the importance of the holistic employee monitoring experience and having a holistic program, I'm going to quickly walk you through a real world example of just how interdependent they really are. And this is, again, a real world example from a client that we were having a conversation with and have gone to help and support in managing this. The story begins back in June 2016, when an employee was allegedly stealing from a patient, in which that employer in 2016 in June had terminated that employee and reported said theft to the license board. So over the course of the next 12 months, the board began the investigation. They were interviewing the employer to understand what had happened, interviewing the professional, just general gathering of evidence within the case. This can take a significant amount of time, as you could suspect. In this example, it took about 12 months for that to be completed. And in June of 2017, the license board officially issued an administrative action against the person or the individual, which this would be the first piece of public information available. And it came in the form of a disciplinary action or a sanction. And a sanction is not to be confused with an exclusion in this scenario. This, I think, was released in a meeting minute of the board meeting that had happened in June. In July of that same year, so a month later, the individual took the position of no defense. So in that case, the board revoked the license. Note that in the event the defendant decided to fight the sanction, this could have extended for many more months. A full 7 months later, at that point, the OIG listed the individual as an excluded person because of that license verification on their OIG LAIE database. That is very typical. We see on average 173 days it takes for state information or state actions to actually turn into an exclusion if they would at the federal level. It's important to note that the OIG maintains the authority to exclude an individual based on the severity of the actions that have occurred. License issues are not mandatory exclusions. So the OIG is taking and exercising permissive authority. In this example, this particular action was egregious enough to exclude this person. So in that same month, SAM, or the General Service Administration's system for award management, which essentially contains a lot of the same information in the OIG, its debarment actions that have been taken by the various federal agencies, also published this exclusion. And at that point, right, the public information is kind of set, right? But what had happened over the next 5 months was really interesting, because this individual moved to a neighboring state and changed their name. The state that they moved to happened to have a medical license reciprocity agreement with the individual's former state. So this is obviously a benefit, and we've talked about it already, is it's supporting advancements in telehealth and it's supporting our commuter society. But in this example, the individual was able to avoid that typical and extensive medical licensure process, and they secured pretty quickly a new license with a new name in a new state and began to seek employment. So the big question is, would you have been able to catch this with your current monitoring process? And in this example, we choose to show this because it really shows the importance of bundling sanctions, licenses, and exclusion monitoring together to help protect your organization and your patients from these types of behaviors that unfortunately just exist today. So we'll spend a few moments about how Provider Trust can solve for this. We've created a smarter, more effective healthcare monitoring platform. We've developed a relationship with our clients to ensure that we are able to help them in managing and tracking sanctions, licenses, and monitoring alerts, and built a platform that helps the organization develop one central repository or a single source of truth for storing all of the demographic data for their providers and all of their artifacts, credentials, licenses, the like, so that we can make sure that we are managing their expectations. We then go through some efforts to ensure that we've got user rules built into it to support your facility requirements around certain disciplines needing certain types of licenses and certifications, and ensuring that that policy meets the needs of the facility but also aligns with your state laws. From there, we automate alerts and emails, leverage dashboarding to ensure that you're notifying your teams, your unit managers, of the actions that require immediate attention, and help them prioritize their day to ensure that nothing is missed in the event you've got an upcoming expiration or a requirement that's missing. And then we help support that feedback loop back into your system of record to ensure that you've got a single source of truth on your sanctions, your license, and your exclusion information, and do all of that with a multi-million-dollar error and emissions policy. The next few slides will talk a bit about how we support the process and flow of data. Essentially, at this point, we want to just show you that that not only are we bringing some of the best data from the primary source to help you make decisions on, but we're also leveraging the existing technology that you have in place, such as your HRIS system, to ensure that there's a constant feedback loop between your data and making sure that that your teams are well aware and well communicated in the event transparency is a big challenge for you, or challenges in collaboration across your organization. You have a great platform to be able to do that. A great use case to talk about for just a minute is the following use case, which demonstrates what we typically see when we implement our licensed monitoring solution. In this example, it was a very large post-acute provider who had implemented our solution across their enterprise for their 40,000 or so healthcare licensed employees. And once we completed the verifications and it began to include these employees in ongoing monitoring, we found that there was quite a bit of cleanup that needed to occur. Essentially, we found licensure issues for 1 of every 8 employees. Things like data discrepancies between the client system of record and the primary source information, or missing credentials, or expired licenses, or disciplinary actions that weren't found, or things that really were difficult to find if you're looking and scraping through public data, in which our enhanced data model was able to find as a benefit of our augmentation efforts. So it was a good use case to kind of talk to what we see whenever we implement our clients. Another great conversation would be if you're interested in determining the effectiveness and the efficiency of your current program. So when we talk to clients, they're often trying to, they're grappling with their process internally. When we're talking to folks like you all who are trying to understand best practices and build a solution, there are a number of things to consider on how you're tracking the way that you're doing things. And I'll take you through a number, and then we'll actually go through what this slide is representing. So the first thing to track is how long does it take your team to identify and respond to a change in a licensure status, right? Are you catching those in real time? Are you catching them after they happened? And what's the risk associated with that? What percentage of your licensed population renew on time, right? We know that that's a laborious task for the individual, and many times this can be overlooked. So what is that percentage? How long does it take to find, to retrieve, to present the proof in the event you're under a regulatory audit of those verifications? How many people have you dedicated to this process, and how many hours are they spending on the task? How many steps do you have required to collect, review, and verify the license, and what's the turnaround time? And do you have any processing errors? And if so, how many? And what's the result of that? So to simplify the entire conversation, let's assume that you've got a team of individuals that are supporting a licensed population of about 10,000 licenses, and you've got this down really well. You've got a very streamlined process, and you're able to verify a license and manage all those tasks within a 3-minute period for each license. On a population of 10,000 licenses, that would take about 500 hours a month, or the complete time of 13 full-time employees. And that's once a month. And that kind of represents the challenge here of managing and administering the process. And hopefully you've found some of these best practices, and obviously the review of the challenge is helpful in determining where's the best place to start for this conversation with your own organization. So I think we've got another polling question, and I'll turn the time over to Mike to kind of round out our conversation here. Does your organization outsource license monitoring and verifications today? You've got a number of choices here. Yes, we outsource it to our credentialing partner. Yes, we outsource it to our background screening company. Yes, we outsource it and it's ongoing monitoring. Maybe that is a monthly scenario, as we've discussed as a best practice. Maybe that's a faster cadence. No, I don't outsource it, I do it today, or I'm not quite sure what the organization is doing. We'll give it a moment for this poll to progress, and we'll read out the results. And again, if you've got any other information that you'd like to share about this question, please provide your comments in the questions pane. That would be very helpful for us. So nearly 50% of you do not have, are not outsourcing this process today, which is not new information, right? We know that this is a manual process. It's great to see it. It's great to see that there's also 25% of you that have outsourced this to a vendor that's providing ongoing monitoring. So it sounds like there's a quarter of you that have a pretty good process in place. It looks like the remainder is pretty scattered between, yes, we've got this outsourced to our background screening company. That might be something that's being done once every 2 years in the event a license is renewing every 2 years or just upon hire and at renewal. Yes, at credentialing, that might be something that's being done at hire. And then from there, it's kind of up to the credentialing organization. And then number 9% is I'm not sure. That's probably because you may reside in a department that doesn't administrate, that have operational oversight of this. So we understand that as well. So with that being said, Mike, I'll go ahead and turn the time over to you so we can wrap up the presentation. I know we've got a number of thoughts to consider.
Absolutely. Thank you, Tim. All right, so we want to give you some key takeaways. As I mentioned, if we only get one thing across, we think that it's important that licenses are a precursor to other and more serious risks to your organization. So let's summarize the effectiveness of good license monitoring. You need a centralized and certainly a standardized process, and you need your policies and procedures to back that up. If litigated, they're going to ask for a copy of the policy and procedure and see if you followed it. So make sure those are in sync and you have a way to constantly be able to prove your compliance to an auditor. There's also a number of compliance standards that could differ by state law and certainly the type of discipline provider. When I say discipline, the type of discipline, if it's doctor, nurse, rad tech, et cetera. And couple that with your job requirements. Make sure that you've thought through, are these tied to what we actually ask for and say we're going to monitor in the job description. You need to be checking more than at hire and renewal, and I hope we've made that point clear, as well as educating you on why. And then for those of you who are dealing with a billable person that is identifiable, even daily monitoring is now available in the marketplace if you wish to consider. And then lastly, as we've identified in the slides, following the person who changed names and had different actions, a more holistic approach, making sure that you tie this in with your compliance program. It's a good conversation to have with those two departments. So with that, Matt, let's turn over a few questions that we had in the remaining 2 or 3 minutes and then set you back onto your day.
Great. So I'll allow some more time here for some questions to come in. If you do have those, please just submit them in your control panel there. And if you have them later, if you think of a question here in an hour or so that you wish you had asked, please don't hesitate to reach out and we will get back to you on that. So it looks like we have one so far. And Patricia asks, if we have a provider that is not yet licensed in our state, can they shadow other providers? Do either of you guys know?
Yeah, Tim, I'll take that. So that is going to depend on state law, and each state may be different in that regard. There are certain states, I know Kentucky and others, that do allow, especially when someone transfers from another state or moves, there's a 90 to 120 day period to get them licensed in your state, which is a little different than your question, but there are those levels of legal requirements that are outlined in your state licensing requirement. So we would have to know what state you're inquiring about, but in a lot of cases, they can shadow, but they can't provide, direct services to a patient and certainly be billed for until they're licensed, unless you fall in one of those states that has a 90 or 120 day probationary period while you're applying for that license.
Thanks, Mike. Jill asks, what is the difference between OIG and SAM's verification, and which one do you recommend?
Tim, I'll take that and you can add. The OIG is the easier one to do. And certainly the one, if you're only to do one, I would do that one at bare minimum. The OIG is a name-based search. And then if there is a possible record found based on the name, it will prompt you to enter the Social Security number and to determine if there's a match. SAM is much less comprehensive, and in most cases, even when you do find a record, they're going to direct you to the agency that put them in there as a debarred individual, and you're going to have to try to play phone tag with a bureaucrat to find out why they're in there. The identifiers are less based on the social than they are at the OIG.
Great, thanks, Mike. And that wraps up our question section of the webinar. So thank you for participating. Just to close out here, I mentioned our resources earlier, and I will make sure that everyone has when you receive your copy of the slides will be clickable. So every link you've seen in here, you'll be able to navigate directly to our resource page or whatever that link may be sharing. And we are happy to share these resources with you. Please let us know if there are any gaps in your knowledge or organization that you would like us to touch on in the future. There is a survey after this webinar, so we would love for you to fill that out and give us some direction. So with that, sorry, here we go. If you do have any questions, please reach out and let me know. And if I don't know, I will direct your question to whoever would be most appropriate for that. On behalf of Provider Trust, I want to thank you so much for spending your hour with us. We value each of you being here, and we know that your time is very important to you, and your roles are important to your organization. So we appreciate you taking the time to spend it with us on this, or for this month's webinar. Please join us for next month, and do look out for the slides and the recording. And as soon as we hear back from the Compliance Certification Board, you will all be hearing from me with a CEU certificate. So thanks again, and I hope you all have a great rest of the week.
Should we record that?